Part A. Extract 1. Questions 1 to 12. You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I'm Nurse Mincendale. How can I help you today?
Good morning, nurse. I'm really worried about my eyes. They've been bothering me for over 2 weeks now, and nothing I've tried seems to work. It's not just discomfort. It's seriously affecting my ability to work and even sleep properly.
I'm sorry to hear that, Mihiraa. Can you tell me more about what's been happening?
Well, it started with what I thought was just mild irritation. I felt like there was grit in my eyes, especially when I woke up in the morning. I assumed it was due to tiredness from staring at the computer all day because I'm a graphic designer. But then it got worse. My eyes became red and swollen, and there's this crusting around the edges of my eyelids. It's like my eyelashes are glued together when I wake up.
I see. That sounds very uncomfortable. Is the irritation constant, or does it come and go?
It's there almost all the time, but it gets worse after I've been working for a few hours or if I'm exposed to air conditioning for too long. The burning sensation is unbearable sometimes. And I've noticed my vision gets a bit blurry on occasion, not in a serious way, but it's noticeable. I also have this sensitivity to bright lights. Even stepping out into the sun feels painful.
That's quite a lot to deal with. Have you noticed any discharge or other unusual signs?
Yes, there's this sticky, yellowish discharge, mostly in the mornings. I've also been losing a few eyelashes, which has never happened to me before. My eyelids feel greasy, but they also get flaky. I'm at my wit's end.
That must be really distressing. Before we discuss treatment, could you tell me a bit about your lifestyle? For instance, do you wear contact lenses or have any underlying health conditions?
No, I don't wear contact lenses, and I don't have diabetes or anything like that. I do wear a lot of eye makeup because of my job. It's almost a requirement in the industry to look polished. I try to remove it carefully every night, but maybe I'm not doing it well enough. I also spend about 10 to 12 hours a day in front of a computer screen, and I rarely take breaks.
Thank you for sharing that. Have you tried any treatments or remedies for your symptoms so far?
Oh, yes. At first, I just rinsed my eyes with cold water, thinking it would soothe the irritation. Then I bought some over-the-counter eye drops. I think they were called artificial tears, which helped a little, but only for an hour or so. I even tried warm compresses after reading about them online, but the relief was very temporary.
Based on what you've described, Mihiraa, it sounds like you might be dealing with blepharitis, which is fairly common but can be persistent without the right treatment.
Extract 2. Questions 13 to 24. You hear a dentist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I'm Dr. Fisher Marvin. How can I help you today?
Good morning, doctor. I've been having this strange sensitivity in my teeth lately. It's been bothering me for a few weeks now, especially when I drink something hot or cold. I thought it was just temporary, but it doesn't seem to be going away.
I see. Can you describe this sensitivity in more detail?
It's more of a sharp, sudden pain, almost like a sting. It comes and goes, but it's worse when I have tea or anything acidic like citrus fruits. Sometimes, even brushing my teeth makes it worse.
That sounds uncomfortable. Have you noticed any changes in your teeth, like discoloration, or does your mouth feel different in any way?
Actually, yes. I feel like my teeth are a bit rougher than usual, and there's this weird transparency at the edges. It's quite worrying because I've never had issues like this before.
Alright, thank you for sharing that. Before we proceed, could you tell me a bit about your daily habits and diet?
I'm a tea checker and I usually taste around 15 to 20 cups a day. I also have a habit of drinking a lot of tea outside work. It's kind of my favorite drink.
Thank you for that information. Based on what you've told me, it sounds like you might be experiencing dental erosion. That's when the enamel on your teeth starts to wear away, often due to exposure to acids. Tea, especially if it's very hot or has a low pH, can contribute to this over time.
Oh no! Is it serious? What does that mean for my teeth?
It's something we can definitely manage, but it's important to address it before it progresses further. This weakens the enamel, which can lead to increased sensitivity and even cavities. Let me take a closer look to confirm the diagnosis. Alright, Mihiraa, I've just completed the examination. As I suspected, there's evidence of the condition on the surfaces of your teeth, particularly the front ones. I also noticed some wear on the molars, likely from the acidic exposure over time.
What can we do about it? Is it reversible?
Unfortunately, it isn't reversible because enamel doesn't regenerate. However, we can take steps to protect your teeth from further damage and manage the sensitivity.
What kind of steps?
First, I'll apply a fluoride varnish today to help strengthen your enamel. Over the next month, you'll need to use toothpaste specifically designed for sensitive teeth, which will help reduce discomfort and protect the exposed areas. I'll also prescribe a remineralizing gel that you can apply at night.
That sounds manageable. Will I need to make any changes to my routine?
Yes, there are a few lifestyle changes I'd recommend. Try to rinse your mouth with water immediately after tasting to neutralize the acid. You might also want to avoid brushing your teeth right after taking tea, as the enamel is softer and more prone to damage.
All right, doctor. Thank you for explaining everything.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a head nurse called Mihiraa conducting a meeting. Now read the question.
Good morning, team. Today, I'm excited to introduce our new uniform. This new design is not just a change in appearance, but a significant step towards enhancing our professionalism and patient comfort.
What are the key features of the new uniform Mihiraa?
The new uniform is designed to be both functional and stylish. It's made of breathable, moisture-wicking fabric to keep you comfortable during long shifts. The pockets are strategically placed for easy access to essential items like pens, stethoscopes, and mobile phones.
Will the new uniform be more durable and easier to maintain?
Absolutely. The fabric is durable and stain-resistant, making it easier to clean and maintain. The new design also incorporates antimicrobial properties to reduce the risk of infection.
How does the new uniform contribute to patient safety?
The new uniform is designed to be easily identifiable, which can help patients recognize healthcare professionals. It also promotes a professional image and builds trust with patients and their families.
When will we start wearing the new uniforms, Mihiraa?
We'll transition to the new uniforms gradually over the next few months. In the meantime, please continue to wear the current uniforms until further notice.
Now look at question 26. You hear a doctor called Mihiraa talking to a cardiologist. Now read the question.
Dr. Benson, I'm concerned about Mr. Liston's recent cardiac event. He's experiencing chest pain and shortness of breath.
That's concerning, Dr. Mihiraa. We need to act quickly to prevent further complications. Let's start him on aggressive medical therapy, including antiplatelet agents, beta blockers, and statins.
I agree. We should also consider cardiac rehabilitation to improve his functional capacity and reduce the risk of future events.
That's a good idea. Cardiac rehabilitation can help him manage his condition and improve his quality of life.
We may need to discuss revascularization options, such as angioplasty or bypass surgery if medical therapy proves ineffective.
Dr. Mihiraa, let's monitor his response to medical therapy and reevaluate his condition in a few weeks. We can make a decision about revascularization at that time.
It's important to educate Mr. Liston about lifestyle modifications, including a healthy diet, regular exercise, and smoking cessation. These changes can significantly improve his prognosis.
Now look at question 27. You hear a physiotherapist called Mihiraa talking to a patient. Now read the question.
Mr. Liston, I'm pleased to see your progress in physical therapy. Your range of motion has improved significantly.
Thank you, Mihiraa. I've been working hard on my exercises.
I'm impressed with your dedication. Let's continue with the exercises we've been doing and incorporate some new ones to challenge your muscles.
Great. I'm ready to push myself.
Remember to listen to your body and avoid overexerting yourself. It's important to balance exercise with rest.
I'll be careful, Mihiraa. I don't want to set myself back.
That's important. We'll gradually increase the intensity of the exercises as you improve. Are you experiencing any pain or discomfort during the exercises?
A little soreness, but it's manageable.
That's normal. As your muscles get stronger, the soreness should subside. If the pain becomes severe or persistent, let me know.
Now look at question 28. You hear a neurologist called Mihiraa talking to a nurse. Now read the question.
Nurse Benson, I'm excited about the new patient monitoring system we're implementing. It will significantly enhance our ability to track vital signs and detect early signs of deterioration.
That's great news. How will this system benefit our patients, Dr. Mihiraa?
By continuously monitoring vital signs, we can identify trends and intervene early to prevent complications. The system will also alert us to any significant changes, allowing us to respond promptly.
Will this system reduce the workload for nurses?
While it won't eliminate the need for hands-on nursing care, it will streamline our workflow and reduce the frequency of manual vital sign checks. This will allow nurses to focus on providing direct patient care.
Dr. Mihiraa, how will this system affect patient privacy and data security?
The system is designed to protect patient privacy and comply with data security regulations. Access to patient data will be restricted to authorized personnel, and strict measures will be in place to prevent unauthorized access.
I'm looking forward to seeing how this new system improves patient care.
Now look at question 29. You hear a GP called Mihiraa talking to a staff nurse. Now read the question.
Nurse Benson, I'm excited about the new patient token system we're implementing. This will help us manage patient flow more efficiently and reduce wait times.
That's great news. How will this system work?
Patients will receive a token upon arrival, and they'll be called in order of their token number. This will help us prioritize urgent cases and minimize waiting times.
Dr. Mihiraa, will this system help us reduce overcrowding in the waiting area?
Absolutely. By managing patient flow more effectively, we can avoid long queues and create a more comfortable waiting environment for our patients.
How will this system impact our appointment scheduling?
We'll need to adjust our appointment scheduling to align with the new token system. We may need to allocate specific time slots for urgent cases to ensure timely care.
Will this system be easy to use for both patients and staff, Dr. Mihiraa?
Yes, the system is user-friendly and easy to understand. We'll provide training to our staff and patients to ensure a smooth transition.
Now look at question 30. You hear a nurse called Mihiraa talking to a colleague. Now read the question.
Have you seen the new patient, Mr. Liston? He seems quite frail and disoriented.
Yes, I did. He's been admitted with a history of falls and decreased appetite. His family is quite concerned about his declining health.
We need to assess his cognitive function and risk of falls. Perhaps a geriatric evaluation would be beneficial.
We need to assess his cognitive function and risk of falls. Perhaps a geriatric evaluation would be beneficial.
Absolutely. Early intervention can help prevent further decline and improve his quality of life.
Mihiraa, we should also involve the social worker to assess his social support system and identify any potential barriers to care.
That's a great point. A multidisciplinary approach is essential to address his complex needs.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a sleep therapist, Mihiraa, and an interviewer.
Dr. Mihiraa, let's start with the basics. Can you define what perfect sleep means, especially from a clinical perspective?
Perfect sleep is a nuanced concept that extends beyond just the hours you spend with your eyes closed. It involves a harmonious balance of quality, quantity, and timing. Clinically, we see it as sleep that refreshes the mind, rejuvenates the body, and aligns with the natural circadian rhythms. Quality refers to reaching restorative stages like deep sleep and REM without frequent interruptions. Quantity varies by age and individual needs. Most adults thrive on 7 to 9 hours. Finally, timing is crucial. Sleeping at irregular hours can disturb the biological clock, even if the other factors seem right. Perfect sleep, thus, is a synchronized system where physiological, environmental, and psychological factors converge seamlessly.
That's fascinating. So, Dr. Mihiraa, what are the key steps to achieve this balance and ensure perfect sleep?
Achieving perfect sleep demands a multi-pronged approach that respects individual variability while addressing universal principles. At the core, consistency in sleep schedules is indispensable. Your body thrives on predictability. Then, we consider the sleep environment. Darkness, quiet, and a cool temperature optimize melatonin production. Psychological preparedness also plays a role. Mindfulness or relaxation exercises before bed can significantly reduce the mental chatter that keeps many awake. Moreover, limiting stimulants like caffeine or excessive screen exposure in the evening is imperative. These steps interact like gears in a clock. If one fails, the system loses its efficiency. Personalization, however, is the most underestimated factor, as what works for one might disrupt another's sleep architecture.
But isn't this balance difficult to achieve, especially given modern lifestyles, Dr. Mihiraa?
Without a doubt, it can be challenging. Modern lifestyles are riddled with sleep disruptors, from erratic work schedules to constant exposure to artificial light. Social commitments and digital distractions often encroach upon what should be restful hours. Moreover, societal norms glorify productivity over rest, which cultivates a mindset that undervalues sleep. However, the difficulty is often exaggerated. Small changes can yield significant results. For instance, even shifting your bedtime gradually rather than abruptly can ease the process. The real obstacle is often the lack of awareness about how much sleep deprivation costs us, not just physically but mentally and emotionally. The difficulty lies not in the effort itself, but in the willingness to prioritize it amidst competing demands.
Dr. Mihiraa, what are the primary factors that affect sleep quality and duration?
Sleep is an intricate phenomenon influenced by a myriad of factors, often interacting in complex ways. Biological factors like genetics and hormonal cycles play a foundational role in determining sleep propensity and patterns. Environmental conditions, light exposure, noise levels, and even room temperature can significantly disrupt sleep cycles. Then, psychological stressors such as anxiety or rumination impede the transition into deeper sleep stages. Lifestyle habits like inconsistent sleep schedules, diet, and insufficient physical activity create additional hurdles. Social factors, including caregiving responsibilities or work shifts, also contribute. Importantly, these elements don't operate in isolation. They compound each other, which is why addressing just one may not always suffice.
So, how can people overcome these hurdles and truly achieve perfect sleep, Dr. Mihiraa?
Overcoming these challenges requires a layered strategy. Start by anchoring your day with consistent wake and sleep times, as it stabilizes the circadian rhythm. Adapt your environment. Blackout curtains, white noise machines, or temperature control can make a significant difference. Mindfulness practices such as progressive muscle relaxation or breath-focused meditation can mitigate stress-induced insomnia. Technology can help as well. There are apps that track sleep patterns and provide actionable insights. However, the less obvious part is addressing underlying health conditions, sleep apnea, hormonal imbalances, or even mental health issues like depression can sabotage sleep quality. Lastly, cultivating patience is key. Perfect sleep isn't achieved overnight. It's a journey of sustained effort and adjustments.
Dr. Mihiraa, why should perfect sleep be such a high priority in our lives?
Sleep isn't just a passive state, it's a cornerstone of well-being. During sleep, the body engages in cellular repair, memory consolidation, and immune system strengthening. Without adequate sleep, the brain's cognitive functions, attention, decision-making, and creativity decline significantly. Chronic sleep deprivation has been linked to a range of illnesses, from cardiovascular diseases to diabetes, and even neurodegenerative conditions like Alzheimer's. On an emotional level, sleep fosters resilience and emotional regulation, making us less prone to anxiety or irritability. Prioritizing sleep is essentially prioritizing every other facet of your health. It amplifies productivity, relationships, and even happiness. Perfect sleep, then, is not a luxury but a necessity for holistic well-being.
Now look at Extract 2. Questions 37 to 42. You hear Dr. Richard Rustin on understanding patient behavior at Mihiraa Healthcare Institute. You now have 90 seconds to read questions 37 to 42.
Good morning, esteemed colleagues, and thank you for gathering here today to delve into the ongoing behavioral research conducted at Mihiraa Care. As psychologists, we are bound by an inherent curiosity to understand the human mind and its nuances. Our latest study at Mihiraa Healthcare Institute reflects this pursuit, employing sophisticated methodologies to dissect patient behavior across multiple dimensions. This presentation will walk you through the intricacies of our study, its significance, key focus areas, and the anticipated benefits and challenges. The research at Mihiraa Care employs a hybrid methodology combining quantitative and qualitative techniques. This dual approach allows us to capture both numerical data and the intricacies of individual experiences. Data collection is rooted in structured observations, clinical interviews, psychometric assessments, and real-time monitoring through digital tools. Patients are observed within controlled environments that mimic daily life scenarios, offering insights into their natural reactions. For instance, one key phase involves deploying wearable devices to track physiological responses, such as heart rate variability during stress-inducing tasks. Meanwhile, semi-structured interviews are used to uncover deeper layers of thought patterns. The triangulation of data, where findings from different sources are cross-referenced, ensures our results are robust and multidimensional. However, the complexity of human behavior necessitates layers of validation. We employ longitudinal tracking, revisiting patient responses at different intervals, which provides context to shifts in behavior over time. This methodological rigor ensures that Mihiraa Care's results stand as a benchmark in behavioral psychology. The implications of our findings at Mihiraa Care extend far beyond the confines of the Healthcare Institute. At its core, the research reveals how environmental and internal stimuli shape human responses. One significant trend observed is the interplay between stress-inducing environments and coping mechanisms. For example, patients exposed to high-frequency interruptions tend to develop fragmented thought processes, a finding that has implications for workplace mental health policies. Furthermore, the research sheds light on resilience-building strategies. Contrary to conventional wisdom that resilience stems purely from an individual's internal will, we find that external factors like social support networks play an equally critical role. These insights compel us to revisit therapeutic practices, integrating social reinforcements alongside cognitive techniques. The study thus challenges established paradigms, encouraging us to embrace a more holistic approach to mental health care, a philosophy deeply embedded in the ethos of Mihiraa Care. At its heart, this research revolves around understanding triggers and responses. Mihiraa Care has prioritized the examination of micro-triggers, small, often overlooked events that significantly impact a patient's emotional state. By identifying these triggers, we can better understand the cascading effects that escalate into more pronounced behavioral issues. Equally, the study explores the concept of emotional inertia, the persistence of a particular emotional state beyond its trigger. Understanding why some patients linger in states of anxiety or despair while others bounce back quickly is pivotal for tailoring interventions. Moreover, the study gives considerable attention to the role of neurodiversity in behavioral responses. While many studies generalize findings, Mihiraa Care celebrates the diversity of human cognition and seeks to uncover personalized approaches to care. We anticipate this research will redefine how mental health care professionals approach treatment. Mihiraa Care is committed to translating these findings into actionable frameworks that can be applied both in clinical settings and everyday life. By the study's conclusion, we expect to establish a predictive model for behavioral trends, allowing clinicians to anticipate challenges and intervene proactively. Additionally, this study aims to empower patients. By sharing findings with them in an accessible manner, we aim to foster self-awareness and equip individuals with tools to manage their mental health autonomously. The ripple effect of this empowerment could extend to communities, as individuals learn to manage their stressors and improve their interpersonal dynamics. The benefits of the study are multifaceted. For patients, the research paves the way for more precise diagnoses and personalized treatment plans. Mihiraa Care's holistic methodology ensures that each patient's unique behavioral patterns are acknowledged and addressed. For practitioners, this research serves as a repository of innovative strategies. From identifying subtle triggers to developing resilience-enhancing techniques, clinicians will have a richer toolkit to work with. Furthermore, the data will serve as a valuable resource for policymakers, helping to shape mental health programs that reflect real-world needs. Beyond the immediate applications, the study underscores Mihiraa Care's commitment to advancing the science of mental health. By setting new research standards, the Institute reaffirms its role as a leader in psychological innovation. Despite its strengths, the study is not without challenges. Human behavior is inherently fluid and influenced by countless variables, many of which are difficult to replicate in controlled settings. The complexity of real-world triggers means that not all scenarios can be simulated. Another limitation lies in patient diversity. While Mihiraa Care works with a diverse pool, no sample can fully encapsulate the spectrum of human experience. This raises questions about the generalizability of findings. Additionally, longitudinal studies demand significant time and resources, making it challenging to maintain consistent participation. Lastly, there is the ethical dilemma of balancing observation with intervention. While monitoring behavior is crucial, the act of observation itself can alter patient responses, a phenomenon known as the Hawthorne effect.
That is the end of your OET listening test. Now check the answers.